Hello, everyone, and welcome to our discussion about arts as a method of coping mechanism in time of pandemics and not only. Now, generally speaking, medical personnel is one of the most vulnerable category of professionals because they are all the time exposed to various stimuli. I'm together with my colleague, Dr. Ioan Mira, who is a psychiatry resident at one of the most prestigious psychiatric hospitals in Romania, namely Professor Dr. Alexandru Breja Clinical Psychiatric Hospital. And he's currently also studying philosophy at the University of Bucharest. He's an avid enthusiast of the arts and culture and also very passionate about the history of medicine. During his university years, he introduced to his colleagues a series of artistic and cultural projects aiming at medical humanities with a desire to integrate art, culture, philosophy, and history into any medical student's interest. Welcome, Ioan. And
thank you very much.
Thank you for accepting our invitation. Briefly about myself, because here is not about me, it's more about my colleague, but in order for everybody to know who the speakers are, I must say that I am also a medical doctor and currently finishing my PhD in philosophy of medicine at the University of Bucharest. When discussing about this matter as part of medical humanities perspective, my colleague came with an interesting tool that the medical personnel can use now in times of pandemic, but not only. Now, Ioan, I have a question because we discussed in private about what burnout is in general, but I know you avoid this term. And in order to to put a light on this topic, can you tell us more about what this mental fatigue and emotional fatigue means, especially within the medical staff?
Okay. First of all, we have to assess that the burnout syndrome, as all of us know it, is not actually classified as a medical condition. The definition from the ICD-11 stands that it's actually an occupational phenomenon and is resulting from a chronic workplace stress that has not been successfully managed. It is characterized by three dimensions. First of all, the feelings of energy depletion and exhaustion, then an increased mental distance from one's job or feelings of negativism, cynicism, and also reduced professional efficacy. During these hard times for any medical professional, this widespread of burnout can lead and led already to exhaustion, detachment, ineffectiveness at some point, lack of accomplishment, and I think one of the most important things that was somehow lost for a medical professional is this compassion fatigue, which we started to experience due to our stress exposure.
Mm-hmm. Well, in this case, now we are talking about arts, right? Let's bring this performing art, because I think you're referring at arts in terms of painting, right?
Not only, I'm referring at art from two main perspectives. First of all, we have the visual arts, the fine arts, where painting, drawing would be the best example, the easiest to access, and the literary arts, where I think the easiest would be poetry.
All right, good. So you're covering the entire umbrella of arts.
Yes.
Now, okay, and how do you see this umbrella helping medical personnel in the relief of inner tensions from stress?
Okay, first of all, we have to assess and to be conscious about the fact that any artistic endeavor, let's call it artistic endeavor, has two main components.
Mm-hmm.
The act of creation and the creation itself, the result. And both of these components, we're going to talk about them in a bit, give solace, give self-acceptance, and also a very authentic immersion in one's self.
Okay, so now you're going to the mechanism, right? On how it works. Can you tell us a bit more about all these?
Yes. First of all, as a disclaimer, the things that I'm going to say are not very, let's say, scientifically accurate, or as doctors are used to, very evidence-based, because this is not the point here. First of all, I see art as a pause, as a break, somehow of an escape from daily life. This is a disinvestment of the self, where you focus only on the act of creation. So this art as a pause is actually the embracing of the act itself, having this cathartic state, the release of emotions through art, and also can be perceived as a depletion of tension, of negative feelings. It's in a way a form of a meditative flow.
Mm-hmm.
Secondly, we can see art as a mirror. And in this mirror environment, let's say, I'm going to talk also about what's behind me in virtual background. Art as a mirror, meaning a source for self-knowledge. The examination of one's art result, this time we're going from the act to the result, and you become your own observer. For example, what do you see here is actually a painting that I did by myself. I'm not an artist. I'm also, anyway, I'm an artist, but I'm not a professional one. I don't have studies, because to do art, you don't have to have professional studies. So I use art personally to find things about myself.
Right.
And I have a very, let's call it a childish theory about art. I call it the clay interpretation. So just imagine.
Right, right. I was sorry, I was thinking, so you can actually give us a personal example of how you perform art without being actually a scholar in terms of art, without having a background in arts, right? So you can
Yes.
actually tell us about the way you, how can I say, relieve the tensions from yourself. Sorry, just give us all the details because it's very interesting.
Okay, so all the details about this are, let's say, embedded in my little theory about this clay. Let's say your inner self, you can call it mind, you can call it soul, you can call it however you want. It's a lump of clay, that brown clay used for sculpture. And in that clay, you have many shapes, like Lego shapes, for example, that are embedded in that clay. Obviously, you can see the outside layers. Obviously, you can see a pyramid, but you don't know if that pyramid inside is actually some part of a cube. You can see half a square, half a sphere, but maybe it's just a half of sphere, maybe it's something else entirely. So
Right.
basically, the apparent rational image of your emotions is masked every
Mhm.
time, I believe. Through art, you transform this clay to a translucent one. So basically, you can see inside yourself the actual Lego shapes that are your emotions.
Mm-hmm.
For example, you paint something, you write something, you take a step back, and then you analyze it. Your piece of art, even though it's unprofessional, it's not something on a Picasso level or on a Edgar Allan Poe level, but your piece of art is somehow um, independent of yourself. It has a new, let's call it metaphorically, life. So you can observe that thing, let's call it this way, from an outerly perspective.
So you
You
become
can,
like a third person.
yes,
Okay, so you detach a little bit from yourself in order to be able to analyze through the end product,
yes,
right? Because now at my back, for our discussion, I placed a painting made by Carl Gustav Caruth, who was a German physiologist and painter. And he was very well renowned on that era, mainly in the late 18th century and the beginning of 19th century. He was also known as being a Goethe friend, uh, but he was also a naturalist, a scientist. But the painting that we see at the back is a very studied one. I mean, he didn't do it as a catharsis manner of expressing his feelings. He just painted, how can I call it, a very methodologically, in a very, very methodological way. But how can we integrate this perspective of, let's say, a lay painter, the physician, without having a background in arts, can be known as a lay artist. But we also know that physicians are full of fear. They have a certain profile in dealing with his lack of self-esteem. No, he's a perfectionist. And we always try to do the best to convince ourselves that we can succeed, because art is also about performance. No, wouldn't doctors fall into the same trap of putting so much pressure when they actually need to release it through art? I mean,
yeah, that's
no.
uh, yeah, that's actually a real problem because doctors have this, we can call it amateur fear, because they have the tendency, as you said, to excel, to be the best in their field, and often they do not accept just to be okay at something or to be amateurs. Their art actually would not be published, but would still have that meaning for them, even though they're not professional, even though they're not as good as a well-established artist. They don't have basically the techniques necessary, but you don't need them, because we actually do not realize that in writing we already have all the utensils we need. The words, we know words, we know how to write, so we can write anything we want.
Right.
We have a paper, we have a pencil, we have colors, we can do visual arts also. The techniques are something that are not of importance for us at this point. Even though they have this failing, this fear of failing, because they have the desire to save, to raise the problem, but without having these techniques, you still can do something for yourself,
Yeah.
using art as a refugee, as a journal, as a lesson. And this would be a very, very good lesson of being just an amateur, maybe, and enjoying simple things, not only to be the best in something.
But interesting. So you didn't only speak about arts as a theoretical thing to do, but you actually proved that this is a tool, a proper tool to express yourself. Now, Probably for some of the physicians, this is the way of doing it, of releasing tensions. Others would write, as in a journal. Others will draw, just simply draw. No. So the answer would be each and every one of us should discover the way of relieving, of having this catharsis through art. Right.
Yes.
Thank you. Thank you very much, Yuan. Thank you for your very interesting discussion.